Welcome to Mommy Heal Thyself. We feature guests who provide you with the tools, resources, and strategies you need to say no to a life of pain and suffering from all forms of preventable disease, toxic drugs, and unnecessary surgeries. We hope to inspire you to boldly reclaim your ability to heal and to serve the ones you love. Welcome, everyone, to another episode of Mommy Heal Thyself. Today, I have with me Dr. Patricia Berube, and she integrates cutting-edge procedures and technology into her practice, and she is a pioneer in her field, incorporating both Western and Eastern approaches to care. She has advanced technology and training in minimally invasive surgical techniques and laser procedures, and she is a board certified in periodontics. The practice has evolved to specialize even further in techniques using biological dentistry, ceramic implantology, periodontal plastic surgery, and functional periodontics, which is a growing concept to include how to best support the body as a whole. She continually works to help to shift the paradigm using materials and methods that are healthier and longer lasting to the patient. So, Dr. Patty, welcome. Thank you for being here with us.
Thank you for having me. Good morning.
I am just tickled pink. As you know, well, my audience doesn't know, I've been working for months to try and get Dr. Patty on with us because this, as she says, is a phenomenal new kind of approach to something that most of us take for granted, which is our dentistry, the health of our teeth. So before we go any further, I would love for you to tell us, how did you get into this functional approach? Because I know this is not how you were originally trained.
No. I think, we all have a story, right, of how we got here. So you learn the Western model, and that's great. It's a great foundation. Surgery is surgery.
Mm-hmm.
There are different techniques, and you can learn more atraumatic techniques and little things over time. It's been 20 years for me. So, but what prompted me is, in my life, I became, I want to say, more holistic. It's the same story everybody has. I had an issue. My mother had an issue. You go to the doctor. They say everything's fine. It's in your head. Here's an antidepressant. Just this, you hear this story. It's almost like irony now, or just satire. Is it really? It's real. Yeah. And then so you start to look for other things. You start to look for other modalities of healing. And that's when you realize there's so many things that we haven't learned in school. There's only certain little box of things that we learn. And then once you start digging, you realize, wow, you learn one thing, and then it prompts you to learn another thing. And then you realize how much you really don't know. Mm-hmm. So, it just made sense to add that to my practice. Most of the things that I learn now, of course, I go to surgical courses, but, I became certified in functional medicine. I read books on everything but dentistry. And, people wonder why I do that. But it's because when people come in and they've got some things going on, I want to know what they're talking about. And I do. And if I don't, then it's okay. That's something I don't know. Let's learn about it together. And, people come in and go, wow, I feel heard. Thank you very much. And that's a huge part of healing. Surgery is surgery. I mean, it is what it is. You can go to any surgeon, but the mental state of trusting somebody, feeling comfortable with them, and not feeling like you're being told you're stupid, or you're depressed, you're just anxious. It's kind of a big deal. We've all experienced it in some way. So yeah, that's just it. And then you start going to biologic meetings, and you learn little things here and there to add to your practice. And then you realize some things aren't so bad that I learned, but we can add some things. It's really for the techniques or the diseases where you treat and they don't get better. So it's what's missing there. What can we do? Because surgery fixes certain things, but it doesn't fix everything. Mm-hmm. So that's where all of functional medicine comes in for me, is what else is causing these problems. So,
and that's really where my desire to have you be part of our podcast began, because I started listening to you and hearing something that I don't really hear often, which is the connection between what's going on in our mouth and the rest of our health, and how that is so critical to disease prevention. So could you tell a little bit more about exactly that connection?
well, the biggest thing that periodontists treat, or we're periodontists, so we treat periodontal disease, which is an irreversible destruction of the gums. Meaning, it's not, gingivitis is reversible. You get some bleeding. We all experience that. You brush, you floss, it reverses itself. It hasn't caused any issues that we know of. Periodontal disease is kind of the step forward where you start to have destruction of the periodontal ligament, connective tissue, and bone that holds your teeth in place. That's just the local effects. The systemic effects are in those areas of destruction. It's you're constantly having bacteria and their toxins pumped into the bloodstream. So wherever the blood goes, it can be affected by these bacteria. So one of the most common links that people kind of know is its relationship to heart. So that's, people always hear about bacterial endocarditis. Some people have to take antibiotics before dental cleanings or dental procedures. And that's been well known for a long time. We kind of hang our hat on that. Yet it's we know it affects diabetes and heart disease and stroke and cancer, and I mean any disease, dementia, that's a big one. We know there's a link, but yet there's kind of a breakdown between this Western medicine and dentistry. They just look at us as carpenters, which sometimes we are. But we're blamed for a lot of things. Like, oh, you got bacterial endocarditis, it's because you went and got a dental procedure and you need an antibiotic. But yet they didn't clear the patient before they did their knee replacement procedure, things like that. So there's just so many links in the body. And people come into me and say, I had a heart attack. My cardiologist doesn't know why. And I know why. Usually we can take an oral DNA test, but I can do a clinical exam, take some x-rays, and see that they've got undiagnosed and untreated gum disease. So it's that bacteria that's constantly pumping into your system. And they've actually seen that bacteria in the clots that cause heart attack and stroke. So it's that same bacteria that's in our gums. So yeah, it's a big link. Pregnancy is a big one for women. It's a very small subset of the population that I see. Pregnancy gingivitis, pregnancy, there are things called pyogenic granulomas, which are like little lesions that grow on the gums. And again, never been referred by a OB-GYN, but this is a big deal, because that increase in gingival inflammation can increase preterm low birth weight babies.
And a lot of times we talk about the fact that our birth outcomes are horrific in comparison to other quote unquote developed nations. And yet what you're talking to us about is something that I've had 4 babies, and I never ever recall anyone saying to me, you know what, Michelle, you need to go and make sure that your teeth are checked or something of that nature.
Never.
So
never.
Tell us a little bit more about this oral DNA test, and what are some of the, I guess, things that would make us want to take that test? Because I don't think that you have everyone take the test, or maybe I'm wrong. Maybe you do have everyone take
No, I don't.
So what is the profile of someone who should definitely consider this test, and what is it, and what kind of information can we get from it? How can it help us?
So I think for me as a periodontist, oral DNA test is just objective information. I don't need somebody to take it in my office, because I can evaluate them. I know they have gum disease. We can talk about it. So it's just, again, it's information. I think for me, I think it's an amazing tool. Again, for those patients that have had heart attack, stroke, where they go, I don't know why this happened. And then they see this oral DNA test. Basically, it's a saliva test, and it measures different types of pathogens, different virulence pathogens, meaning some are bad and then some are not as bad.
Mm-hmm.
And, pictures are say 1,000 words. And when you see these these bar graphs and they're all super high, it's very telling. They go, oh, I didn't know that. There's a very big difference between somebody that's got undiagnosed, untreated gum disease versus somebody that hasn't. So I think it's a more important tool, and not in my office per se, but in a medical office. I feel like if you had a cardiologist that routinely did something like that, and they saw huge amounts of bacteria and parasites, then it's, hey, even if they don't know how to look in the mouth and see signs, because sometimes you don't see it. Sometimes you can see it. You can look at somebody and kind of know that's not normal. But that would be an amazing kind of screening tool. And, as part of the same thing with diabetes, and same thing, because that's a two-way street. You're trying to improve blood sugar readings, and you've got this huge infection in your mouth. Guess what? That's hindering your process. So I would love to see medicine really understand that link and take it, and take it seriously. But I mean, in 20 years, it's super rare that I get anybody from an MD. It's super, super rare. So I think that's where that test would shine.
So now you said that it's a saliva-based test. So how does it compare to blood tests? Meaning, are the pathogens that you have on that test also visible in a blood workup that is looking for pathogens, or does it show up in your saliva before it will show up to be a concern in your blood, or what? I'm just curious.
That's a really great question. And I've just never heard of it. I'm sure there is one. It's just hard to get a dentist to take a blood test, period. So, or even, horrible to say this, but even in MD's office, sometimes they send out for blood work. So a saliva test is it can't get any easier. I don't do it. My assistant does it. It's something you can delegate very easily. Blood test's not so easy to do, to delegate. So I'm sure there's a way, but blood tests are more expensive. Well, the saliva test isn't cheap, but the blood test, it's more of a thing because you have to have a phlebotomist. It's just a different process. So I don't know how to answer that question. I just think it's easy.
To go back to what you said, which is that you personally don't need someone to do the oral DNA test. So what is it that you're seeing that gives you an indication that there's a concern for pathogens that precludes the need for an actual DNA test?
Well, I'm a periodontist, so that's just what I'm trained in. I know how to I can diagnose gum disease in a minute. I know how to measure. I can look at x-rays. I can see the bone destruction. Another cause of the pathogens are root canal teeth, and sometimes teeth that haven't been root canaled. So disease from inside the tooth that's gone to the ends of the roots. And it's just important to take the right x-rays. What's happened now, especially I have different types of patients, but I have my more holistic patients and they don't want me to take x-rays. Well, I have to take x-rays. That's the only way to see, especially if they've had a lot of dental work in the past and they have all these crowns and fillings. You don't know what's going on the end of the root. And that is, those again are pathogens that are going into the bloodstream constantly. So that's another level of how bacteria in the mouth and the jawbone can affect the rest of the body. There's that's a huge part of the oral systemic link, not just gum disease.
So what type of x-rays? Are they a specific type of x-ray, or is it just like the general x-rays that your dentist does? And what are some things that I may be experiencing personally in my health that may indicate to me that I need to get that kind of x-ray done just to rule it out?
So this is where old school standard of care comes in. We take what's called a full mouth series. It's 18 small little x-rays so that you can see literally every single tooth and the any infections on the ends of the root. Some dentists don't do that. So they're taking what are called bite wings, and you can only see the biting surfaces of the teeth. So whether or not we take an 18 series x-ray and never ever take it again, it's important. That's still the standard of care to diagnose gum disease, and it's still the standard of care to diagnose any infections or any brewing cavities. It kind of shows everything, except when you have a root canal tooth, if you see an infection on the end, if you see an infection period on that two-dimensional x-ray that we take, it's there. There's no question. However, there's sometimes infections that are there that you can't see on those two-dimensional x-rays. And that's where those cone beam CBCT scans come in. Again, I don't take those on every patient. I take those for implant planning and those types of things. But if there's root canal, I have a lot of people that come in with root canal teeth. We look on the standard x-ray. They look okay on the x-ray, but they want to delve deeper. That's when we take the cone beam. And in terms of symptomology, you may not have any symptoms. Those infections in the jawbone, they can brew and fester and fester and fester and grow big, 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 and they don't have any symptoms. That's why it's important to check. The only way to know is to take the x-rays. So I wish there was, obviously if there's a fistula or the abscess that comes out on your gums, then there's something going on. But I can't tell you how many people have these big, huge infections in the bone that have absolutely no symptoms.
Wow, that's scary. So now let's shift a little bit more to our little people.
Okay.
And what are some things that you have been noticing recently in terms of younger people, children and young adults?
So I don't have a ton of small people in my practice. However, I worked for pediatric dentists before. Cavities, cavities, and of course, inflammation, gingival, gum inflammation. Now that I've kind of delved into this functional medicine world, I've noticed a lot of cavities can be from vitamin D deficiency. And it's something that I don't know of many pediatric dentists that are checking for that. It's pretty easy. It's a finger prick. You can check that. But that's something I routinely do, especially for my patients that are getting bone procedures or that have inflammatory conditions. We really want to know where their vitamin D levels are. Then you can get into, the different nutrients there. So I kind of look at things a little bit differently now that I have that functional medicine lens. I learned a lot about that with my own child. And again, I learned by what I work with in my real life. And he had a lot more cavities than my older son. Doesn't have a worse diet. It's not like he's eating sugar all the time. So what is it? What's the interplay? And some kiddos and some people have what's called a vitamin D receptor defect, VDR, on their 23andMe. Most people don't do that and don't think to do that on their kids, but it's just something to consider. And then just again, looking at the type of toothpaste they use. We kind of go through those types of things. But yeah, I've had to take a step back because the standard, don't eat sugar, brush your teeth with a fluoride toothpaste, not working for my kid. Right. So yeah. And, that's a whole, you can do, hours of podcasts on that.
Well, let's talk about that a little bit. So you spoke about toothpaste, and I would love for you to tell us a little bit more about what you kind of breezed through about, fluoride toothpaste, not for me, kind of thing.
Yeah.
And so you're not going to get away with just trying to breeze through that, young lady. I want you to tell us a little bit more about what you mean, and also what are some other preventative things that we can do to help to enhance the health of our teeth and maintain the health of our overall oral hygiene?
Well, even before I was quote unquote holistic alternative, whatever you want to call our community.
Before you had a label.
Yes, we have labels. That's fine. Label me, it's fine. So I worked for a pediatric dentist before I went to dental school. And I even back then I said, my kids will, I was 21. I will never have my kids use fluoride toothpaste, and I will never give them fluoride supplements, because you see when they have fluoride overdose, first of all, there's a skull and crossbones on the toothpaste label. That's kind of a red flag for me. But when kids ingest too much and they're developing these teeth, they can end up, you see people with white little mottled areas on their tooth, on their teeth. That's permanent. That's going on their permanent teeth. That's not going away. And then in really severe cases, they're brown.
So that's from fluoride?
Yes, that's fluorosis. Yes. So when you think about, well, and then when you start to look at the fluoride's effects on the body, again, that's a thing. So it creates brittle bone. We don't need fluoride in our body. It's not an element that we need. So that's, there's a lot of debate on this. I mean, people disagree with me. Fluoride's great. Well, if fluoride's great, and we've been pumping it into the water all these years, why do people still have cavities? Why do kids have cavities? Any anymore? But what else is it creating? And again, you start to look at the studies on what it's done to IQ and children. And so yeah, even back then, I wasn't doing that. So for what I recommend now, and it constantly changes. When people say they still recommend everything the same 20 years ago as they do now, that scares me a little bit, because there's different things we should be learning, right? Some things are tried and true, and then other things we should learn from and say, I used to say that I used to prescribe high dose fluoride toothpaste. That's what we were taught. Hey, if they have a high cavities rate, prescribe that. Well, you have a patient that's got autoimmune condition and is overweight and has thyroid issues and all of these things. I don't think the high dose fluoride is helping her systemically. So anyway, what I recommend now are toothpaste with hydroxyapatite. So I'm sure there's a million brands. There's Boca and David's. And for my patients that have periodontal disease, David's has worked really well, because there's a sensitivity formula. And unfortunately, when we're treating gum disease, they start to get sensitivity to cold. So that one's helped a lot of my patients with sensitivity. And it has shown that if you're starting to get a cavity, it can remineralize it. Now, if there's a cavity that's huge, it's not going to fix that. And I know there's people that say enamel can be regenerated. When I've never seen it in a big, huge, I've seen little ones regenerate. Another thing that I recommend, and again, this is all stuff that my kid does, he's supposed to do, is vitamin D3. He's 15, so I test him now. Vitamin D3, vitamin K2, and magnesium, those nutrients go together. Vitamin K2 is involved in and magnesium, but both of them are help get that calcium into our bone and into our teeth. D3 by itself, we need that K2 and magnesium. So those three. And then I have him, there's some cell salts that you can get, which is homeopathic remedies, but they're like little sprays. Couldn't be any easier. You can get, I think there's a formula you can get with all three. It's calc fluor, calc phos, and silica are the three dental. Again, not going to hurt him if you take some cell salts. So those are the three main things. A diet of more protein. We've known this forever, right? Getting the correct fats in our system, getting butter in our system, that's K2. And not eating carbs, and carbs is bread. Bread turns right to sugar. Fruit is great, but sugar. I mean, it's that's getting into Weston A. Price's work. So
what about things that we've heard of, like oil pulling or brushing with charcoal or water picks or,
All
that kind
amazing. I mean, I for my gut people with gum disease, I always recommend a water pick. I don't have gum disease and I use a water pick once a day or so.
of.
We have different medicaments that we can put in the water pick,
Mhm.
especially when they have active disease.
Mhm.
My patients that oil pull, I'm not saying if you've got rampant gum disease, you need to get treatment. There's
Mhm.
no, you've got I call
Yeah.
it barnacles under the boat, under the gum line. You got to get that stuff out.
Yeah.
And it's hard. It's hard for me when I'm looking at it with an ultrasonic. So somebody have to be really adept with a hand instrument to get that out.
Uh,
Patients that use oil pulling, their gums are pristine
wow.
in general. And you people argue, well, why wouldn't they just use, mouthwashes? Well, that's a whole other thing because these
Mhm.
mouthwashes have been shown to affect bacteria that modulate nitric oxide, which modulates blood pressure.
Mhm.
And people don't like hear my normal colleagues don't like to hear about that. They said, but this cardiac surgeon said not to use mouthwash because it causes this. What do you think? Yeah, I
Mhm.
haven't recommended in a long time. I'm like, use salt water. You don't have
Mhm.
to rinse with anything.
Mhm.
Um, so it's there's a lot of things you can do. I tell people
Mhm.
do what works for you. There's a million products out there. Just try to use a product that doesn't have a million chemicals in it that you can't pronounce or read, right? Um,
Generally speaking, absolutely.
right? Same thing with food. It's the same thing. Same thing for on your skin.
Yeah.
Those
Absolutely.
are the toxicities that build up over time that may not ever affect one person, but it may affect somebody else.
Well, thank you so very much. And in closing, what is one thing that you feel that we really need to pay heed of when it comes to dentistry and the overall health of our bodies?
So I think, I mean, that's a great question. It's a big question. Um, there's a middle ground somewhere. I'm a middle ground person. I know people say, no, you're not middle ground.
Mhm.
Sometimes you have to get a tooth removed. Sometimes you have to get, some scraping done. Sometimes there's just that there's only so much a supplement can do for you. Sometimes we just need that mechanical action of floss, or we need that hygienist to clean the barnacles under the gum line. So I just think there's two differing. There's the biologic dentists and then the Western dentists, and I think they both have really good things.
Yeah.
And I just don't want. I know and I understand people's distrust of a lot of dentists and the medical system in general. So they've gone way in the other
Mhm.
direction.
Mhm.
And I just, that's not always great either. I think there's a middle ground somewhere. Trust your gut. Get a second opinion if something doesn't make sense. I mean, any dentist should be able to show you on the x-ray or a
Mhm.
picture what's going on. It's if I can see it, they can see it. I mean, they're not
Mhm.
trained to see it, but I can go look at that black area. That's what I'm looking at.
Yeah.
So ask questions. If you have a dentist, same thing with a doctor that is just rude, is just the ego won't let them have a discussion,
Mhm.
then maybe it's time to find somebody different. But again, remember, there's a middle ground, and I don't want people to blindly trust the other side either.
Mhm.
So
Well,
dentistry is important.
I love what you're saying. As my mom always says, there's a time and a place for everything under the heavens. And sometimes extreme cases require extreme actions, and that's just the reality of things. Yeah.
Yes, we're none of us are immune. We all have something that we have to handle. And
Mhm. Mhm.
some people it's their mouth, other people it's something in their body. So
Mhm.
that we're not all evil. But you kind of know, when you go into somebody and you have a conversation with them, take a step back and see if what they're saying makes sense.
Mhm.
So
Absolutely.
yeah.
Thank you so very much. I greatly appreciate you're coming and sharing this information with our community. All right, so ladies and gents, we thought that we were over, but we're not over, because as soon as I finished, Dr. Patty was like, there was something that I wanted to say. And so, Dr. Patty, what is the one thing, the one other thing,
another thing
noticing that you think is a significant issue that needs to be addressed, particularly with our women?
Yes, we take on the world. We have the weight of the world on our shoulders. You know, we're the caretakers. We manage the household, and I'm saying in general, right? Every family's different, but we have our hormones running through us. We deal with the monthly, perimenopause, menopause, childbearing, all of that. And most of the people that I see, and I'm not saying all, but the people that have significant diseases, say like Lyme or more autoimmune conditions, so usually women, I would say 9 out of 10 are women, and they are stressed out. And it's super, super hard for me to sedate them. A normal max dose on most people works amazing. People fall asleep, they're snoring. But with that stress response, I see it in younger women. Wow. And I don't know what's changed and what's different. It's like they fight it. So I think, we all have to take that advice, right? We're constantly running in sympathetic mode, like we were talking about. We're constantly like, I've got so much to do. I have constantly something on the to-do list, and constantly being in that fight or flight is so detrimental to your health. Those are the people that I see with the autoimmune conditions and Lyme. I don't see people that aren't stressed out with those conditions. I mean, again, that's a super generalization, but we cannot understate how important it is to try to get into that parasympathetic mode. And I'm guilty of it. We all are, whether I'm 50, somebody's 20, somebody's 30, there's all these different life stages, but especially with women, I don't see this in men as much. Men are just like, women. So I think that's a missing piece, and it affects everything that you do. Every experience you have is not going to be a good one when you're in that sympathetic mode. Yeah. Unless you're just completely put out with general anesthesia, then you can't control it. But yeah. So that's it. That's the missing piece with health and with every day. I keep saying every morning I need to meditate or just sit and relax and deep breathe. And people think you're crazy when you say that, but it's really important. I mean, patients that have super high blood pressure in my chair from being nervous, as they sit back and we do some deep breathing exercises, the blood pressure goes down. It's very, very, very powerful, but we don't stop and ever do that because we don't let ourselves take care of ourselves. Wow. That's mostly with women.
Well, that's a powerful message to leave us with, Dr. Patty. And thank you so very much once again.
You're welcome. I appreciate you inviting me.
Yeah. And ladies, until next time, peace and blessings.
Bye.
Thank you for tuning in for this episode of Mommy Heal Thyself. If you like what we're doing here, please share, subscribe, like us, and leave a comment. Your feedback is